All right. Hi, Dr. Rodriguez. My name is Jackson Nesin-Perna. Here is a picture of, I'm trying to make sure you can see it, a picture of my name and then the date. Yeah. There's nothing else on this side of the page. And then I have my notes today, which I tried to write my name, but I didn't think it was very legible, so I made that other page. And then here are my notes with the printed out topics, and then the notes that I have that I just wanted to run through. Okay. Um, so, what we have today that we're talking about a couple different definitions, and then and what they are in my words, and then we're going to go through some examples. So we're starting off with disease definition, and I think the textbook has a pretty good idea, and I just kind of simplified it down a little bit. To it's a disease is an illness that causes a dysfunction in one or more of the body's systems, and so like what that means is that like there are different ways you can like look at the human body, and I believe when it's talking about systems it's talking about like organ systems, or like the endocrine system, circulatory system, immune system, different things like that. And so if there is dysfunction to one of those systems or more, then that would be characterized as a disease. Specifically, there are classifications of diseases. So there's it talks about in the textbook talks about acute versus chronic, and there are some more that we'll talk about. But oh, actually, going back really quick, the example that I was going to present of a disease, something I was reading today in the cancer section, talking about the different types of neoplasia, was lymphangiosarcoma, which is like the what's it called? The malignant form of cancer in the lymphatic vessels. So it's a growth of the lymphatic vessel tissue, the endothelial um, lymphatic vessel tissue, and so that's an example of a disease I was reading about today. Um, so the two different types of disease classification that it presents is acute versus chronic. Acute is like a short-term um, like disease state that is resolved in a short period of time, but is significant in the short term. Versus chronic is a longer-standing disease state, and the severity of these differ depending on the type of disease it is. Um, and so then getting into the etiology of it, so I viewed etiology as like the kind of cause of a disease or the thing that actually is what leads to it. And so there's etiologic factors, and there can be many of them, including like radiation, chemicals, genetic mutations are some, and specifically the etiologic factors can either be acquired or congenital. So acquired means that you acquired it after birth. Congenital means you were born with it. And an example of a acquired um, an example of an acquired um, etiologic factor would be like a bone break. So if you got into like the etiologic factor for a bone break would be like a car accident. And the etiologic factor for like an example of a congenital disease could be um, like Tay-Sachs is a genetic disease, and so that'd be a congenital because you're born with it. If you have Tay-Sachs, which is a fatal illness. Um, the pathogenesis is the next thing we're going to talk about, which is basically how the disease progresses from you from like the exposure to the etiological factor to the expression of the disease. And so the example that what was I going to say for my example of pathogenesis? I guess we can talk about like, so for example with I don't know, like a car accident. If the etiologic factor is a car accident, how it progresses is you're exposed to it, which is that there's excessive trauma that's done to a part of your body. And if you're in the car accident, let's say like you like break your, I don't know, your let's say you're like humerus or something, right? And so you hit, you get into a car accident, your arm breaks, and you get some sort of fracture. And the pathogenesis of that is that the force of the car accident causes the bone tissue in your arm um, to fracture and to break apart. And there's a bunch of chemicals from like the actual break that's released, and there's a bunch of inflammation signaling that happens, and that's the pathogenesis, how it develops, and the pain that accompanies that, and how you have to get it fixed because there can be internal bleeding and other stuff like that around it. Um, Then the next thing you want to talk about was symptoms. So symptoms are, so there's signs and there's symptoms. Symptoms are subjective complaints from a patient. An example of this could be like if a patient is having a heart attack and they walk in, they say, I feel like an elephant is on my chest. That would be a symptom. And then a sign would be something that is like a clinical manifestation that you can actually like measure in some way. So for somebody who's having a heart attack, if you check their pulse and they are either having like an irregular pulse, an arrhythmia, or some type of other like irregular pulse, then that's a sign that there's something happening. Versus a symptom would be like them complaining about it, saying it feels like there's an elephant on my chest. A syndrome is a cluster of signs and symptoms that don't have a distinctive or not distinctive, but like a agreed upon cause. And so the presented syndrome they talked about in the textbook was chronic fatigue syndrome, which is if you have had chronic stress for a long time and have not like gotten adequate care and relieved from that stress, you can get chronic fatigue syndrome, which is like a combination of a bunch of different signs and symptoms of like elevated, and that there's a, it talks about it in a later chapter, but there's like elevated the alert stage, and then there's the fatigue stage, and then the exhaustive stage, I believe. And so there's like different levels to it, and yeah. So then there's diagnosis, which is our next topic. So diagnosis is basically the designation by a healthcare professional of the cause of something. And so basically it's like given the an exhaustive history of the patient, a physical examination, and then if you want, you can also run diagnostic tests to try to find a better answer for what the issue could be. Then you come to a conclusion based on the information presented to you as to the diagnosis for the patient. And attaching to that, the diagnostic tests. A diagnostic test is a test that's ordered by a physician or by a healthcare provider to informs about to provide more information about like what is, I guess, what is the cause of something. So if you want to get genetic testing, that's a diagnostic test. If you come in with and you're like unresponsive, you might get a CAT scan, a CT scan, because that could help diagnose what's going on, if it's in your brain or elsewhere in the body, or potential damage done to the body. And so there's different diagnostic tests depending on what you need. Complications are possible extensions of a disease. So for example, if you have cancer, if you have like I don't know, some type of like carcinoma, and you and it metastasizes, that would be which is it develops into a stage where it's able to spread throughout the body. That would be a complication. And then prognosis is like the clinical prediction of how the treatment will go. And prognosis is really important for understanding what the next steps in treatment are, because prognosis for a cancer patient in their 20s is very different from a cancer patient in their 80s. Because sometimes when you're older, it's not necessarily worth it to do like an invasive surgery to try and treat something if you're already pretty old, especially because you have decreased ability to like recover from surgery or from trauma and stuff like that. So there's different, and versus someone who's 20 is a lot more capable of being able to recover from that like surgery, and it's a lot more important for their quality of life for a longer period of time and to extend their life longer because they're younger. So there's different like reasons why you'd want to utilize a prognosis or use it to inform your decisions. So yeah, and then I'm trying to think. I think I missed an example. An example of a diagnosis that I didn't give an example of a diagnosis, but like lymphangiosarcoma would be an example of a diagnosis. So given like a biopsy and given like all the family history and a physical examination of someone who we think suffering from cancer, diagnosis would be saying this is what I think the cause is. It's lymphangiosarcoma. I think that's everything. So yeah, if not, please let me know. Thank you very much and have a wonderful day.